Your child has a sore throat. Ugh. Is a visit to the clinician necessary? How do you know if it's strep throat? When is treatment needed? And what the heck is a strep carrier? This video will cover all of these questions and more. Make sure you stick around until the end to hear about the reasons we treat strep. It may not be why you think. I am Dr. Mona, a pediatrician and mom, and I help empower parents with easy to understand, evidence-based information so you can make the best choices for your children. Make sure to like this video and subscribe here to PedsDocTalk TV to stay up to date on the latest videos and new content. Strep throat is an infection of the throat and tonsils by a bacteria called Group A Streptococcus. Group A strep can cause many different infections in kids, such as a skin condition called impetigo and cellulitis. But we're talking about strep throat in this video today. It is common between the ages of 5 to 15 years of age and accounts for about 15 to 30% of cases of pharyngitis, which is pain or inflammation of the throat. It can affect infants and toddlers as well, but it is very uncommon in this age group. It is spread through droplets in the air from someone coughing or sneezing or direct contact with secretions or a wound if we're dealing with skin infections with Group A strep. It typically peaks in winter and spring, which is why you may be hearing a lot about it right now. Children over the age of 3 years will typically have abrupt onset of symptoms, including fever, headache, sore throat, abdominal pain, nausea, vomiting, and decreased appetite. If you look in the child's mouth, you'll often see a red throat with white pus-like patches on their tonsils, although the white patches aren't always present. Also note that not all white patches on the tonsils mean strep. Some viruses can cause white patches. Children's lymph nodes on their necks may be enlarged and tender. Kids may also have a pink, fine, sandpapery rash that often starts in the groin or armpits and spreads onto their chest, back, and extremities. Strep throat that presents with this type of rash is also called scarlet fever. It's important to note that not all sore throats are caused by strep. Sore throats are actually more likely than not to be viral and resolve on their own without treatment. One way to differentiate a viral illness from strep is to look for classic viral symptoms such as a cough, runny nose, diarrhea, or a hoarse voice. These symptoms are typically absent in strep, and their presence makes streps much less likely. Seasonal allergies can also cause a sore throat, but typically allergies will also present with sneezing, runny nose, and itchy or red eyes. For more information on seasonal allergies, make sure you subscribe to this channel today so you don't miss next week's video. It will be all about seasonal allergy symptoms and ways to manage them. Interestingly, kids younger than 3 are very unlikely to get strep. It's thought that they are unlikely to get infected due to antibodies they received before birth, and also because they have small or underdeveloped tonsils. Although unlikely, I have seen some cases of strep in toddlers, and symptoms can be more mild, such as a slower onset of congestion, low-grade fever, enlarged neck lymph nodes, decreased appetite, and irritability. These children usually have a sibling in the home with a positive strep case because strep is contagious. In older children, the main reason that treatment is necessary is to reduce transmission. It is such a contagious illness and can spread quickly among household members or classrooms. Treating an infected individual with an appropriate antibiotic such as amoxicillin or cephalexin typically eliminates their ability to spread the illness within 12 hours of initiating treatment. That means as long as your child is fever-free for at least 24 hours, and is at least 12 hours out from taking their first dose of antibiotics, they are no longer considered contagious and can return to school or a childcare setting. So when is a visit to the clinician needed? It's best to take your kiddo to their clinician for evaluation if they are over the age of 3, have abrupt onset of multiple symptoms including fever, sore throat, and/or lymph node swelling, abdominal pain, nausea, vomiting, headache, and/or decreased appetite. It's also worthwhile to see your clinician if symptoms aren't improving within 24 to 48 hours of starting antibiotics, or if symptoms are significantly worsening. Muffled voice, inability to swallow, or trouble turning the neck are symptoms that need to be evaluated in person. Your clinician will examine your child, likely swab the back of your child's throat, aka the tonsil area, with swabs. One swab is a rapid test, which is done in the office and takes less than 10 minutes to come back. If negative and there is still clinical suspicion of strep, a throat culture is sent off, which takes at most 48 hours to return. Throat cultures are more sensitive, so there are some cases where we see rapid strep results be negative or normal, but cultures come back positive. It is recommended to start antibiotics only if there is a positive test. Treatment is recommended for all symptomatic children over the age of 3, but it may not be for the reason you think. Many parents think strep needs to be treated with antibiotics so kids can feel better since it's a bacterial illness. Interestingly, even without antibiotic treatment, most children will feel better after 3 to 5 days. Antibiotics typically do speed up the timeline, helping kids feel better within 24 to 48 hours of starting antibiotics, and can help with that contagiousness factor that I mentioned earlier. But the most important reason to treat with antibiotics is to prevent the risk of future complications. Antibiotics are typically amoxicillin or an alternative if your child is allergic. Remember that if your child has strep, to complete the full course, which is 10 days, do not stop if they improve clinically before then to achieve full clinical treatment. Untreated strep can result in the spread of infection to other parts of the body. Sometimes it can lead to common infections such as an ear infection or a sinus infection. Less commonly, it can result in an abscess or pocket of infected fluid around the tonsil, or an infection of the bone behind the ear. It can also very rarely cause severe infections if it spreads to other parts of the body, including a life-threatening soft tissue infection called necrotizing fasciitis, or streptococcal toxic shock syndrome, which is an infection in the bloodstream that leads to organ shutdown. I know, both of those sound scary, and they can be, but they are both extremely rare. You may have heard in the news an increase in severe strep cases this past year. This worried a lot of parents, but when compared to prior years, cases were actually comparable to pre-pandemic levels. So this is media panic and nothing out of the ordinary. This is likely because many individuals have resumed normal activities and stopped measures to limit the spread of disease that were commonly practiced during the pandemic, such as social distancing and wearing a mask. Another potential complication is post-streptococcal glomerulonephritis. Try saying that 3 times fast. In this situation, one's own immune system attacks its cells, but this time the kidney is affected. It typically presents 1 to 2 weeks after a strep throat infection, and symptoms can include dark urine, sometimes brown appearing, swelling in the face, hands, and feet, decreased urine output, and fatigue. It typically resolves after a few weeks, but rarely results in long-term kidney damage. Very rarely, untreated strep can lead to a delayed complication as well. One of the main reasons we treat strep is to prevent something called rheumatic fever. Rheumatic fever is a serious inflammatory condition that causes the body to attack its own tissues. It can result in damage to the heart, joints, and central nervous system. It typically presents 1 to 5 weeks after an untreated strep infection and presents with fever, soreness, swollen joints, chest pain, shortness of breath, fatigue, small painless bumps under the skin, or jerky, uncontrolled body movements. It is treated with antibiotics and anti-inflammatory medication, but it can result in long-term heart disease or heart failure. PANDAS, or pediatric autoimmune neuropsychiatric disorders associated with strep, is another very rare and poorly understood condition. It portrays a sudden onset of neurological or psychiatric changes that occur after a strep infection, with symptoms like tic movements, severe anxiety, or compulsive behaviors. Although the condition needs more research, it's thought to be possibly a result of antibodies mistakenly attacking brain or nervous tissue. If there is a concern of pandas, an infectious disease doctor and/or neurologist is the best specialist to see. These complications sound scary, and I admit that they can be. But it's important to remember that these illnesses are actually extremely rare in developed countries where antibiotics are much easier to access. If strep is treated appropriately, children are at very low risk for these complications. It's also important to note that it is extremely rare for children under the age of 3 to have complications from strep throat. Therefore, testing for strep and treating this age group is actually not routinely recommended. Yeah, you heard that right. There's no need to rush to the clinician for a strep test for a baby or young toddler, as even if they do have strep, which is rare to begin with, like I mentioned earlier, complications are also extremely rare and treatment isn't needed. There is no data to show that there is transmission from toothbrushes back to throats to reinfect them with strep. So throwing out your toothbrush is not necessary, but it certainly won't hurt to switch out toothbrushes once an antibiotic course is finished. I usually recommend this if we are seeing cases of back-to-back strep in a child in that they got strep, finished the full course of antibiotics, the 10 days that I mentioned, and then they get it again 2 weeks later. This could be that they just got it again, or it could be reinfection. Also make sure to eliminate sharing of utensils and cups from an infected individual with family members for at least 24 hours on antibiotics. If your child has more than 7 episodes of true documented strep in a year, which means at least fever, enlarged lymph nodes, exudates, which are those white patches, with a positive culture for strep, a discussion is warranted with an ENT doctor if a tonsillectomy is necessary. But it's also important to remember and know if your child is a carrier for strep to avoid unnecessary procedures. Adults and children can have colonization or a persistent presence of group A strep in their throat. This means that people who are carriers of strep will test positive for strep even if they are perfectly healthy. That is how we often find out children are strep carriers. We see frequent positive strep tests and test them when they're asymptomatic or without symptoms, and the test is still positive. Estimated between 2 to 20% of children may be carriers of strep. People can be carriers for months to years, and treatment is not recommended for asymptomatic carriers because they are unlikely to spread strep to others and are low risk for developing complications from strep. This is important to consider when deciding if you need to have your child tested. Even if your child has a known close contact with strep, like a classmate or sibling, if they're a strep carrier, it's unnecessary to get them tested unless they're showing clear symptoms of strep that I mentioned earlier. Otherwise, if they are feeling well, testing may result in a false positive and unnecessary antibiotics. In rare circumstances, a provider may recommend treatment for a strep carrier if there is a history of recurrence in the household, but this is best to discuss with your clinician. There you have it. What strep is, how to differentiate from allergies or viral illnesses, why and when we treat it, and what it means to be a carrier of strep, and why those younger children don't normally need testing or treatment. If you found this information helpful, please like and share this video. Also, make sure to ask any questions in the comment section and subscribe to this channel to be the first to know about new videos published. Upcoming topics for videos include seasonal allergies, which often flare up in the spring, and newborn jaundice, so you won't want to miss that. I'll see you all next week for another video here on PedsDocTalk TV. Stay well.